So now what I want to discuss briefly is ABGs and essentially how the basic elements of how to understand what the values mean and how to interpret them in scenarios that would provide different illnesses dealing with respiratory, metabolic, acidosis, or alkalosis. So to start off, when we're doing arterial blood gas, what we're looking for is we're assessing the gases within the arterial blood, meaning it's going to be more concentrated in oxygenation, and it's going to have its value that we're looking for when it comes to carbon dioxide. Your arterial blood gas will yield three reference values that we want to focus on. The actual ABG is going to give you a lot more, but these are the three that we really want to focus on. That's going to give us an idea of what the ABG is going to be when it comes to interpretation. So your pH, or your power or potential hydrogen, is supposed to be 7.35 to 7.45. Make note that the range is up to 14, and it could be as low as 1. Neutral is 7. But our blood's pH, it's supposed to be 7.35 to 7.45. This means that our blood is supposed to be slightly alkaline. And that's important for you guys to know. This is why they always tell you to eat your vegetables, because a lot of vegetables contain a lot of alkaline in it, and it makes our blood a bit alkaline, which is good for our health. When we're talking about this narrow range right here, folks, we mean that all metabolic processes, in order for them to occur naturally and without being impeded by any issues, the blood's pH has to be between this narrow value. And once it starts going beyond it or below it, we cannot carry out metabolic processes like we should, and the patient develops deviation from homeostasis. So let's keep in mind that what we're really looking for here is hydrogen. Hydrogen is the acidic element that our body has in our bloodstream. And our lungs and our kidneys, along with our buffer system, they normally work with one another to maintain this therapeutic range. So when we're talking about issues like, let's say, metabolic acidosis, you have to understand that it says metabolic because it has nothing to do with the respiratory system. It has to do with the way that your body functions. And when we talk about metabolic acidosis, we're saying that there's an excessive concentration of hydrogen that's building up in the bloodstream. That could be because of kidney failure, because your kidney helps eliminate or excrete or retain its hydrogen ions. But if you have kidney failure, you can't get rid of it. Same thing if you have sepsis. If you have sepsis, you have a lot of acids that are building up because of the infection, and your body has a hard time reducing it because they have sepsis. That will also lead to metabolic acidosis. Another condition that will be included in metabolic acidosis is diabetic ketoacidosis. When you have hyperglycemia and it's very uncontrolled and you lack insulin, your body knows that the cells are starving. So since the cells are starving, your body breaks down fat thinking it's going to help in feeding the cells. The problem is there's no insulin. So your glucose continues to go up, and now you have ketones in the bloodstream, which are acidic, and those ketone bodies is what develops what builds up when you have diabetic ketoacidosis. And so in diabetic ketoacidosis, that is an example of metabolic acidosis. And the patient will have Kussmaul breathing because it's their body trying to fix the issue. The lungs try to take over, and they try to compensate by eliminating hydrogen or acidic ions in any way it can, which is by eliminating CO2, because CO2 increases hydrogen concentration in the bloodstream. That's what it does naturally. That's why it's important for you guys to know that CO2 represents acid and HCO3 or bicarb represents alkaline. All right, so again, pH will be 7.35 to 7.45. We bring down the 35 and the 45, and it gives us our CO2 therapeutic range, which is 35 to 45. And then our HCO3 should be 22 to 26. I know a lot of books say 22 to 28. This is the agreed upon value that we're always going to be working with, so please memorize them. So we discussed how metabolic acidosis may develop, right? What about metabolic alkalosis? Well, you have to understand, both acid and base or alkaline must be in their therapeutic ranges in order to maintain homeostasis, right? But if you have a condition of, let's say, where your body is losing its acids for whatever reason, what type of scenarios can lead to that? What about an NG tube at suction? Aren't you getting rid of the acids? And isn't that a metabolic issue, your body, as opposed to a respiratory condition? That will cause metabolic alkalosis, Another one would be, what if you have a patient who's vomiting excessively? They're losing their acids. Well, if they're losing their acids, what's left inside? Base, alkaline. So the patient develops metabolic alkalosis. What if the patient takes a lot of antacids? Antacids reduce the acidity in the gastric acid. It's the same concept. Your acidity decreases, hence the alkaline is in higher concentration now, so you develop metabolic alkalosis. When it comes to respiratory issues, they always stem from a respiratory issue, okay, guys? That has nothing to do with the body, it has to do with the lungs. So in respiratory acidosis, you should understand that carbon dioxide is the ion that represents acid, right? So any type of situation you have impaired gas exchange, I don't care what it is, guys, but if you have impaired gas exchange, you're not at the alveoli level, or the air is not coming in and out how it's supposed to, excluding hyperventilation, by the way. When somebody has this respiratory acidosis, that means that they're retaining a lot of CO2 and the lungs are at fault. So a couple of conditions that can lead to respiratory acidosis would be, let's say, emphysema, asthma, bronchitis, COVID, tuberculosis. What about an excessive amount of anesthesia? Maybe the patient has hypoventilations. Anything that decreases the respiratory effort, folks, or impairs gas exchange will cause your CO2 to accumulate in your bloodstream. Hence, you'll develop respiratory acidosis because it's being caused by the respiratory system. In the contrary, you could have respiratory alkalosis, and the concept is the same. You have a lot of concentration of alkaline or base because you don't have acid. You don't have CO2. So sometimes if the patient hyperventilates, what are they getting rid of? CO2, carbon dioxide. And what does CO2 represent? Acid. So therefore, that's you're getting rid of the acids, and that's going to give you your respiratory alkalosis. So just keep in mind, folks, that when it comes to these disorders, you have to separate what constitutes metabolic issues, non-respiratory issues, and anything that affects your respirations will usually cause respiratory and then acidosis or alkalosis.